That day, a patient came to the dental clinic. He kept saying he was in pain, but after a careful check, the doctor found no cavities or inflammation. The only strange thing was that in the patient's oral x-ray, there were some white shadows near the roots of his teeth. The doctor could not see any problem, so he told the patient to go home for now. That evening, as the doctor was about to leave work, he suddenly noticed several small worms floating in the sink that the patient had used to rinse his mouth. He was shocked and quickly picked up the filter, only to find it full of tiny worms. Feeling disgusted, he threw the filter into the trash can. Then he suddenly thought of something, hurried back to his office, and zoomed in on the x-ray for a closer look. This time, he finally saw the truth. The white shadows near the tooth roots were actually countless worms. He had never seen anything like it, so he went to consult a senior doctor. But the senior had never encountered it either and told him to check medical archives. The doctor searched through many books and finally found a record in an old document. It turned out to be a kind of parasite called a toothworm. It would lay eggs near the teeth and then slowly burrow into the organs and brain. A few years ago, after a biological experiment, these worms were supposed to have been destroyed. Reading this, the doctor felt terrified. Just then, he received a call from the hospital. The same patient had come back, and this time the pain seemed even worse. Standing outside the ward, the doctor hesitated. Finally, he tapped on the glass and told the nurse to wear goggles and gloves for protection. But the nurse thought he was overreacting and urged him to come in and help. Cursing under his breath, the doctor put on 2 masks and goggles and began the operation. With shaking hands, he cut open the patient's gums. The moment he removed a few worms, the patient's expression twisted in agony. Then the worms, as if enraged, began to burrow madly into the patient's brain. In the next second, the patient bit the doctor's neck and lunged at the nurse. The doctor fell to the floor in panic and fled into the next room, clutching his bleeding neck. But it was too late. He felt something crawling inside his body, and his teeth hurt like they were about to explode. In despair, he grabbed a dental drill and drove it hard into his own gums. At that moment, he heard scratching on the glass. He turned and saw the nurse pressed against the door like a zombie, her face pale. Then he realized she was infected too. Soon, his eyes began to hurt sharply. Looking into the mirror, he saw worms crawling into his eyeballs. A few seconds later, the doctor convulsed and completely lost control.